Welcome to the CereCore Podcast, where we focus on the intersection of healthcare and IT. From practical conversations to strategic thought leadership, let's unpack the decisions, challenges, and journey of those whose purpose it is to deliver technology that improves healthcare in their communities. Today, we are pleased to welcome to the CereCore Podcast, Dr. Ryan Stone. Dr. Stone is the Vice President and Chief Medical Officer at Schneck Medical Center in Seymour, Indiana. A doctor of osteopathic medicine with a master in biomedical science, Dr. Stone has been part of the Schneck community since 2015, serving as an internal medicine and pediatrics hospitalist for over 10 years, and now as a physician executive guiding clinical strategy and quality across the organization. He completed his medical training at Kansas City's University School of Medicine and Biosciences and completed his internal medicine and pediatrics residency at the University of Missouri, Kansas City. Dr. Stone brings a unique perspective to this conversation, the ability to see technology, quality, and clinical culture through the eyes of someone who's lived it at every level. Dr. Stone, welcome to the CereCore Podcast.
Thank you very much.
So let's start at the beginning. Tell us what led you to become a physician and what you love most about practicing medicine.
Yeah, kind of a long journey for me to end up in medicine, but the ultimate thing was the human connection that comes with medicine. And so for me personally, started from a faith-based university in undergrad and really felt called to help take care of people from that foundation. And so went into my master's program for biomedical sciences to prepare for medical school, and then landed in medical school there in Kansas City. All through my medical school journey really kind of was drawn to pediatrics, and really loved working with kids. And towards the end of my medical school career, found this unique combination of internal medicine and pediatrics to be able to take care of everybody from kind of birth to adulthood. And so fell in love with it, really fell in love with adolescents at the time, and really kind of helping our adolescents transition from the pediatrician mindset to adult health.
Yes.
And so really kind of was anticipating kind of moving in that direction for residency or after residency. But in the midst of residency, really fell in love with hospital-based care and the impact that you could have on a patient and their family in their most critical time of health, and just really being able to journey with folks in the middle of crisis, and to be able to oftentimes make them better, but also in those times where death is imminent, to be able to journey alongside of them in that very human moment as well. And so fell in love with the hospitalist medicine aspect of things, and really wanted to be able to do both pediatric hospital medicine and adult hospital medicine, which led me to Seymour here at Schneck Medical Center, where they had established a med-peds hospitalist program. And so was able to come in and join that program in 2015 and have never left. I've just loved every minute of it.
That's excellent. And you said, you joined Schneck in 2015 and it's a meaningful choice, right? To build a career in a singular community. So what's kept you in Seymour? And perhaps was there a moment where you knew you wanted to kind of take that also next step into more of that executive leadership role?
Yeah. So, the human connection is really what drove me to medicine. And I would say the human connection is really what has drawn me to Seymour and kept me here. Because, when I came into Seymour, really the only thing I knew was that the Interstate 65 was here, and
Right.
my family was about an hour away. We'd come over and hit 65 and head south for vacation. And so when I came into Seymour, my first visit, I really didn't know anything about the organization, but immediately was overwhelmed with the connection that people had, and it was the people taking care of their own friends, families, and neighbors. And so, again, that human connection within the team of providers, both physicians and nurses, and all the ancillary staff, that took a lot of pride in the care that they were providing to their community. And so, was very eager to join a practice like that. It helps that my family is about 45 minutes away. So, I teased them that I was the only one to escape, but I was also, came back, and I'm, close enough that if something happens, I can get there pretty quickly, but
Right.
far enough away that they need to call and let me know they're on their way. So make sure I'm home. But it's that the ability to be close and to be able to take care of your community that's really kind of kept me here in Seymour. And so after joining the medical staff and being a part of the hospitalist group, being in a rural community, you're not just a physician at the hospital. You're oftentimes, pulled into, hey, can you help teach this to new nurses? Or, hey, can you sit on this committee for reviews and that kind of stuff? And so you start taking on additional roles that are not necessarily medicine background. And I started doing a lot of that. And right before the pandemic hit, the chief medical officer position came available. And at that time, I'd only been practicing for about 5 years. And so really didn't feel like I was qualified by any means of the imagination to step into a role like that. But had a lot of conversation with the current executive team, with my hospitalist medicine team as well, because obviously that was going to change my role in that group, and had overwhelming support that this certainly felt right for me. It also felt right to the other team members, and so applied and was officially appointed then in March of 2020, right before the pandemic hit.
Yes.
Literally like days before.
Perfect timing. Perfect timing. No, that's great. And, having visited, and certainly, we've had team members there, just the culture that organizationally that you all have built is just phenomenal. And just the pride that you all take in the services that you deliver and in your role in the community. It's just special. And so I can certainly see where that's a draw for someone that has that mission driven, it's sort of quality about them. And, because of that, Schneck's earned, two of healthcare's most prestigious recognitions, the Malcolm Baldrige National Quality Award, and then 5 consecutive Magnet nursing designations. So as CMO, how do you keep that culture of quality alive on a day-to-day basis?
Yeah, I think we're very honored to be recognized with the Malcolm Baldrige and the Magnet designations, but it's beyond the recognition that comes with those. Again, it comes back to we're not just taking care of random people. Right. These are the people that we go to church with, that we go to the grocery store with, that our kids are on the same ball teams. And, and so there's that added connection that I'm not going to do less. I want to put forth my absolute best at all times in that situation. And so, we have a lot of people that take a lot of pride in the care that's provided to the community. Right. And we're not perfect, right? That's not to say that we don't have areas that we can always improve on. But I think the drive that has helped us achieve these honors is literally just the desire to care for each other in a very personal way that has kind of elevated everybody to that same expectation.
No, that's fantastic. And Craig Rice, your CIO, joined us recently on the podcast and walked us through your Schneck's journey, the MEDITECH Expanse journey in depth, right? From from the selection of the EHR to go live to optimization, and did a great job talking about it from that executive standpoint and from a technical standpoint. But from the physician side of the house, what is that technology transformation meant to the clinicians?
Yeah, I think we were all ready to have a change in EHR by the time that we started having the conversations. And we were a previous MEDITECH user, and so the old system was jokingly we would call it an MS-DOS a solution, and it was an old system. Right. It did the job, but it was an old system. And so when we started to explore what was out there and having the ability to go onto MEDITECH's campus and really kind of see a demonstration of what the product really looked like, man, it just stirred all sorts of excitement for what improvements we could do for our clinicians in all aspects, right? From the physicians, the advanced practice providers, to the nursing staff, our respiratory therapists, the lab, registration. Oh my gosh, registration! Like everybody that had a touch to the system was going to have an improvement in their workflow and their abilities. And so I think from a physician standpoint, we had lots of conversations about updating order sets and workflows and documentation, and how do we make things flow so much easier so that you're not duplicating in 100 different places the same information. And so, we immediately, when we went live, it was like night and day. Just the amount of additional, there's a learning curve for sure, but the additional time that you got, because you didn't have to worry about, hey, did you make sure you documented it here and pulled it over here and selected it over there? And it just really was a huge benefit. And we went live in August, and very quickly we're not just putting out fires for the go live, but the really transition to optimization very quickly. Right. From a overall story. And then as part of that was we were very intentional of, now we have to continue the progress, right? So how do we integrate more AI into things? How do we integrate more technology into things? Are we using the correct versions of the different applications and that kind of stuff to make sure that things are flowing like they need to? And so it's just been super exciting over the last 9-10 months for all the changes that have happened.
Oh, that's excellent. And you mentioned those two key letters put together, AI. So and I don't think in today's day and age, you can't, get through one of these conversations without talking about it. So, from a CMO perspective, as you're thinking about AI's role, and there's a lot of different roles inside of the hospital health system, but when you think specifically about clinical care, where do you see the greatest current opportunity for AI, and where perhaps would you urge some caution?
I think one that we have seen the biggest impact, and certainly talking with my other hospitalist leaders across the nation, is really the use of AI in the documentation side of things, right? And being able to walk in and have an ambient listening device that helps to kind of pull in the information, that helps to accurately document the conversation, the plan, exam, all of those kinds of integral parts that we need to be able to document, and do that hands-free is really awesome. And that technology just continues to improve every day, right? Like it just is continually optimizing from that standpoint. And so we're excited to be able to continue that journey. And I think that's something that will continue. I think the other side of things from a documentation standpoint is the insurance nightmares of prior authorizations and needing additional documentation for X, Y, or Z. That just, from a physician who wants to be sitting in front of a patient and not in front of a computer, that is a drain on all of us. And I understand that we need to be judicial in the healthcare system and how we're using healthcare dollars. But me sitting in front of a computer to rebut a denial from a insurance company of a person who's not trained in what I do, it just doesn't sit well. And so being able to use AI to help that as well. I do think that we're getting to a point now where AI is competing on both sides.
It is.
And so I think right now I'm fine. If that means that I'm not doing it, great. Sounds good.
That's right.
But I think there's some of that we'll end up having to reel in a little bit.
Agreed.
You mentioned, kind of where do I see and kind of hope that AI kind of gets us moving forward. I think from a clinical care standpoint, AI is going to be even more important when it comes to more personalized medical care. And so where I see this, really from a specialty standpoint, we have AI that's being used in oncology and hematology and genetic disorders and those kinds of things, really kind of getting into the point where you can really get very specific to a person's anatomy and physiology to make sure that we're doing everything in order to make them better without causing additional side effects, harm, and complications. And so I think that's where I see AI taking more of a co-pilot lead with the physician. I don't think I know this is oftentimes a patient concern that I want a human that's actually leading my care. And I think what we've tried to have that conversation around our facility is that I, as the physician, am still the person that's in charge of what's happening, right? AI may tell me or help me to kind of come up with a solution, but I'm the one that ultimately has to make the decision to move forward with a treatment plan. And so I think that's where I think we see the biggest change and opportunities moving forward. And I think, in talking with patients that have a little bit of concern about using AI in their care, we have to remind them that AI has been involved in some degree for a long time, right? I use the example with our EKG machines. When we hook a patient up to an EKG, that computer tells us, is it sinus rhythm or not, right?
Right.
AI is doing that, right? And so it's a machine learned program. And so when we can use some of those kind of more mild examples, it helps, I think, to kind of relieve some of that fear and anxiety of technology taking over the healthcare space.
Yep. No, that's excellent. That's excellent. We talked a little bit about the program that you just walked through, and our partnership with you all has spanned that MEDITECH implementation, posting optimization, and more. We always ask these questions, which is from a physician leader's perspective, what is a true technology partnership outside of your four walls look like, or what should it look like for you?
Yeah, first of all, I can't say enough about the CereCore team that we worked with. I mean, from the beginning. I mean, talking about partnership, man, that team came in and worked right alongside of our team to help kind of build a product that we could go live with as a few kind of hiccups in that first couple of days of go live that I would have ever imagined. And so I think the team that we've had, and I'll shout out Lindsay Tahiri, because I mean, man, she is phenomenal. But I think when I look, to answer your question about what does partnership look like, she's really kind of the epitome of what that looks like, because she has been such a good resource for us And, if she doesn't know what the answer is, she's going to find the answer. And she can help to connect us to other people, whether it's within CereCore or a partner that they've worked with in the past, just from her own experience and in the system. Right. It's just been phenomenal. And not to a point where it's no, you have to do this, but it's this is what the program allows you to do, but here are some things that we could probably do to try to help optimize it, make it a little more Schneck. And so I think that has been a godsend for our go live to be able to, and not even just go live, optimization. Man, like the team has continued to be engaged with us as we've made changes and upgraded things. We did our first priority pack update back in January, February timeframe, and again, the team that was engaged with that has just been just outstanding. Yeah,
that's excellent. Well, appreciate the mention, and certainly I think that our team members work hard, and and many team members, particularly on the IT front, they do a lot of work behind the scenes, right? Our team's no exception to that. What would you want those individuals who aren't at the bedside to know about how their work impacts physicians, clinicians, and ultimately the patients?
Yeah, what I would say is I can't do my job without their help. And I think, we really kind of talk to our medical staff and our nursing staff that the EHR is just a tool, right? It's just another tool in the toolbox to be able to take care of our patients. But you want a tool that is ready to be used and easy to use. And I think from the IT perspective is, when I tend to not necessarily be super patient when technology doesn't work for me.
Yes.
And make the joke of, yes, I've already turned it on and turned it back off, right? Like whatever. Yep. But I think the background folks of making sure that the tool is ready to utilize and taking the feedback of, this just doesn't work quite right. We need to figure out, get rid of some of the clunkiness of the system, taking that to heart to know that I'm not just complaining because it's another click, but really from a functional standpoint, like this is where it would be the best. Right. And so, the impact that those team members in the background have are countless, because every few seconds of optimization for me mean minutes to hours of time that I can actually stand in front of a patient. So I think that impact is just immeasurable.
Yeah, I appreciate that perspective for sure. And, I wanted to spend just a couple of minutes on leadership and getting your perspective on it from that, CMO physician perspective. So, we have a lot of folks that listen to this that are, in the IT space and other areas inside of the organization. But, what leadership advice would you give to other healthcare leaders when it comes to developing, building, sustaining better relationships with the physician community? And talk about it perhaps in the context of both current and then the next generation of physicians.
Yeah. I would say the first thing is you don't have to have a title to be a leader. Mm. And I think that was something that I learned very quickly here at Schneck, was that just because I, wasn't a director or a manager or a, physician leader, physician executive, I was still leading throughout our organization just by being present and available. And again, I think it goes back to my mention at the beginning of just the humanistic side of things. And I think the best leaders that I have worked with are those that are just present. And it's not a matter of always saying yes. It's not a matter of always saying no. It's not a matter of having the best idea all the time, but it's being able to be present and willing to work with somebody, across the desk to be able to get to the final solution. I'll be the first one to say that I am not, I'm not skilled on the business side of things. I'll just say it that way. I don't have an MBA. I'm not somebody that went into medicine to be a business person, right? But I think the human side of the business of medicine is that the patient doesn't get lost in the middle of everything. And so I think for us as physician leaders, we need to be able to make sure that the patient comes first in all aspects. And so that human connection, making sure that they're well taken care of, and being truthful and honest in that interaction. Because I think if you're trying to fake it, it'll shine through in an instant. And so I think the best way to be a leader in any instance, regardless of your title or no title at all, is just simply being available, present, and willing to have that human connection.
Yeah.
And I think those people have always kind of filtered to the top in my mind.
No, I think that's great advice. And certainly I think once when you are present, when you are interacting, when I guess you could even say, walking a mile in the other person's shoes, right? You begin to see that perspective, and you begin to understand where, each individual, person, discipline, et cetera, is coming from a background perspective, and then pulling it all together under the umbrella of the mission of the hospital, right? Because they're all different, like you said, right? I'm not a business person, but I am a physician, and I do care about the patient, which is the ultimate goal. They both have to work together, but in order to do that, you have to have that relationship, which I think was certainly great advice. Well, Dr. Stone, as we wrap up today, we always like to just finish with a call for any final words of wisdom for our listening audience. Maybe something that we either didn't get to in the conversation that popped into your head, or just even a recap.
Yeah. Again, I think my biggest advice is don't forget the human on the other side of your interactions. And so I think no matter what your job title is, how you're interacting with the healthcare system, there's a human on the other side of it. And so we can put all the technology and all the other resources around it, but there's still a human to human interaction. And I think that's the most important thing that we can't lose sight of, especially moving forward as technology continues to evolve, that the human to human interaction is the most important, no matter what.
Indeed. Well, Dr. Stone, thank you so much for joining us today on the CereCore Podcast. Appreciate your time, your insights, and the work that you do there in the Seymour community for Schneck.
Appreciate you inviting me to be a participant. And again, certainly appreciate all the work that CereCore has done with our team as well.
Well, thank you.
Thanks for listening to the CereCore Podcast. We hope you enjoyed this conversation. Follow us on your favorite podcast platform for more episodes. Connect with us on LinkedIn. Visit our U.S. website at CereCore.net. And for those abroad, visit CereCoreInternational.net. Learn more about our services and find resources. At CereCore, we are healthcare operators at heart and know the difference that the right IT partner can make in delivering quality patient care 24/7. Let's help make IT better. Here's to the journey.